Multiple myeloma is a cancer of plasma cells. Normal plasma cells are found in the bone marrow and are an important part of our immune system. Dr. Greg Silverman joins us live right now to discuss this further. Dr. Silverman, this is a very serious diagnosis. When one hears this from the doctor, what are some of the first questions they should be asking?
Well, some of the first questions are, what tests do I need to have? Where can I go to get treatment? And how effective is the treatment going to be? That is, what kind of multiple myeloma do I have? Do I have a kind of there are differences in the activity of the cells. Are my cells very active, or is this something that we can kind of watch for a while?
So what are some of the signs, the symptoms? How would I even know that there's an issue?
Well, the problem with multiple myeloma is that it affects the cells that are in your bone marrow, and the cells itself start creating chemicals that destroy your bones. So anything that is in the bone marrow, remember what's in the bone marrow: white cells, red blood cells. So it can push all those out. You can become anemic. You can become weak. The other thing that it does is cause what's called lytic lesions, which are erosions in your bone, because the cells produce a chemical that increases the erosion in your bones. So you can get patchy bones and sometimes breaks in your bones without actually doing anything. So those are the most common symptoms. Other symptoms include kind of stomach upset, just kind of feeling malaise, just not feeling very good.
So what are the standard treatment options for this?
Well, it primarily is chemotherapy, and then you can go into different types of therapy. That is, certain types of autoimmunity types of responses where there are chemicals that will go after the cells, the specific plasma cells that you have. And those are kind of down the road. Most of it is just chemotherapy. And
the mortality rate here?
Relatively high if it gets to be pretty serious towards the ends. To be honest with you, I don't know exactly how many per 100,000. It's not a very common cause of cancer, but it's not a great cancer to have.
Okay, well, Dr. Silverman, we really do appreciate you being in this morning. Thank you for joining
Wednesday.
us. Hey, that's
Have a
right.
great day.
That's right. Thank you, sir. We appreciate it.